Hello everyone, welcome to Farm Animal Techniques. This video should give you a brief overview of the course. Farm Animal Techniques consists of 6 laboratory sessions. At the conclusion of the labs, you will be tested for mastery of the material by a written and a practical examination. Check the schedule posted to see which days you have labs. Because it is challenging to schedule all of the third-year students in the various classes, the labs are usually not on consecutive days, and you will need to check to see which days you have the various labs. Lab 1 is a physical examination video that you will be expected to review online. There's a link to this on Carmen. You will be expected to review Lab 1 video prior to the second lab, where you actually get an opportunity to practice what you have hopefully learned in the video on real live cows. During the first meeting of the course, we will be happy to discuss any questions that you may have had in regards to the physical examination video if you've reviewed it by this time. We will also go over important notes that you will need to know for food animal cases. This lab, Lab 1, will be held in the Veterinary Medical Center, or the VMC. Lab 2 is a bovine lab. Like all of the other bovine labs, this lab will be held at Finley Farm. During Lab 2, you will have the opportunity to practice physical examinations on live cows. We will also review with you the rectal examination and techniques involved in the mouth of cattle, like the passage of a stomach tube or a balling gun. During Lab 3, we will teach you how to perform jugular and tail bleeding on cows, epidurals on cows, and TB testing, also on cows. We will review the sites for IM and subcutaneous injections, also on cows. This lab, as with the other bovine labs, as said previously, will be also held at Finley Farm. Lab 4, which is the last bovine lab, will demonstrate proximal and distal paravertebral nerve blocks in cattle. This lab also held at Finley Farm. For Labs 5 and 6, you will return to the VMC, where we will demonstrate sheep techniques and swine techniques for Labs 5 and 6 respectively. We will talk a bit more about the exams at the end of this video, but the 7th meeting of this course will be comprised of a practical examination. The written exam will be a take-home, online, Carmen quiz format. The labs that are held at the VMC, Lab 1, knot tying, Lab 5, the sheep lab, and Lab 6, the pig lab, will start at 1 p.m. Labs that are held at Finley Farm, Labs 2, 3, and 4, will start at 1:30. This will allow time for students who are enrolled in new electives time to get to Finley Farm. Please be safe when driving to Finley Farm. We would rather you to be late for a lab than get into an accident. This is especially important during winter when the roads may be icy. You likely all know how to get to Finley. However, if you've never been there, head west on I-70. You will go through Hilliard and pass into Madison County. About a mile after entering Madison County, you will take exit 85 and then turn left or head south on Route 142. This is Plain City, Georgesville Road. You will go over the bridge crossing I-70, and then the farm will be located on your right-hand side. It's the first exit off of 142 on your right. Go through the Finley Farm gate. Once you go through the Finley Farm gate and drive around to the back, you can park. We will be using barn 4. If the farm workers are still catching up the cows in the head catches, it would be best to not go into the pen because the cows will be harder to catch. If the cows are already caught up and you feel comfortable, feel free to go in and you can start your physical examinations. The instructors will make every effort to get to Finley on time prior to the start of lab, but please be patient with us. We are usually working in the clinic prior to going to Finley, and sometimes we are cutting it close with timing. Remember that we are working on live animals. Biosecurity is very important, and we want to limit the spread of contagious and especially zoonotic diseases. Since we purchase old cull dairy cows for the bovine labs, things like Johne's disease is common amongst the herd at Finley. Other diseases that are possible include caseous lymphadenitis and ORF in the sheep. Please ask the clinician the best way to clean your boots before you leave the lab. I would advise removing your coveralls after leaving the lab, and having a trash bag to place your dirty clothes in is also a good idea to keep your car from getting dirty. Please take your coveralls home and launder them. In the case of Finley Farm labs, you should not return to the barn of the VMC until you have clean clothes. All of the sheep have tested negative for Q fever before we acquire them for this lab, and it is highly unlikely that they are infected with Coxiella burnetii. However, the sheep usually are pregnant during their stay at the VMC, and sheep with aborted fetuses or fetal fluids are the main way that Q fever is spread. We mention this disease special because of its zoonotic potential, and we advise wearing gloves when working around them, which is also good for the prevention of ORF, which is more common. If you are pregnant or immunocompromised and feel uncomfortable working around the sheep, please let us know. Medical records are very important with our teaching animals. We need to document everything that we do to each animal. This is what the teaching animals record looks like. Please make sure that every entry is dated and initialed. You need to specify what lab was performed. You can include physical examination values, but this is actually not necessary. If medications like sedation was administered, this is also noted in the data sheet. Volumes of lidocaine used for the paravertebral nerve block lab should also be recorded. If you notice any abnormalities that require veterinary attention, please inform a clinician as well as noting it in the medical record. It is appropriate to just record the lab number that was performed for most labs. When filling out the medical records, it is important to be accurate and be concise. Include things that you do that are not wrapped up in a specific labs, for example, the drugs that were given. Please be careful including findings and treatment recommendations. It is very important, I will reiterate again, if you put any findings that require veterinary attention or treatment recommendations that require veterinary attention, to let a clinician know. Just noting it in the record is a good way that these treatments and findings may get missed and proper veterinary care is not carried out. Please do not fabricate records or give animal things like feelings like sad, lonely, etc., for these are not professional and can get us in trouble if our records are ever audited. There is a written and a practical examination that will assess your mastery of the material included in this lab. The written exam is worth 70% of your final grade, and the practical exam will be worth 30% of your final grade. The written exam will be an online take-home format as a Carmen quiz. The window for taking the exam will be 1 week long and will begin the day after your last lab, which is Lab 6, the pig lab. You will have 30 minutes to take the exam once you begin. It will be an open note exam and you are permitted to collaborate with others. However, be mindful of the 30-minute limit. For the practical exam, we will meet at 1 p.m. in the large animal hallway outside of Ward 3. This is where the sheep and the pigs are housed. You will be asked to perform 3 or 4 of the techniques that you have learned over the course of the rotation. A list of the techniques that you may be asked to perform are included on Carmen. A PDF of this presentation is also included on Carmen for your reference, so you don't have to watch this entire video again. If you have any questions in regards to this class, please feel free to get in touch with me. I'm Niehaus.25. You can also try to contact the farm animal office, and either myself or another clinician can likely answer your questions. Thank you, and we look forward to seeing you in lab.